I was talking to my Uber driver on the way to a midwifery conference, and he told me that back home, his mother was always surrounded by women in his community when she had her babies. Becoming a father in the US, he couldn't find this kind of care, and his wife had a complicated surgery, hemorrhage, infection. She still wasn't herself a year later. The US is the biggest spender on healthcare, and yet we have the poorest outcomes. 4 out of 5 maternal deaths are preventable, as are the complications that this father talked with me about. The disparity gap is wide. Care in our communities from our communities is the missing piece to address health disparities. And doulas, a model of care that provide continuous emotional and physical support, are key to improving outcomes. It's a foundation that all policymakers agree on. There's nationwide traction to get doulas in birthing rooms everywhere. But finding this care is a mess. In our listening sessions, one client told us how disconcerting it was to be communicating personal health information over Instagram. It's the Wild West, and indeed, birth workers have been operating in a largely unregulated industry. We have Care.com and babysitting apps, but none of these solutions account for providers that operate with medical records. And payers in managed care know that doula care can save them billions of dollars, but how can a fragmented industry of thousands of organizations and providers do business with large plans? Everyone agrees, use more doulas, save money, and save lives. But we definitely need better logistics to make this care affordable without creating more underpaid and undervalued care workers. We need an infrastructure. I'm Karen Lang, the founder of Ocanti, and it's because I have 30 years of experience in this industry and also as an entrepreneur in this care space that I developed these solutions. Ocanti's Care Finder is the only all-in-one scheduling, booking, and practice management solution that matches people in minutes to a range of specialists covered by their insurance or available out of pocket. This platform is designed for people to find better care, but it's uniquely designed to build a cohesive community-centered workforce that can play a key role in the future of healthcare. With this new model, doulas can interact and communicate securely. Billing is handled, as are many back-end operations, but we don't ask for providers to give up their autonomy. And this is how we stand apart. Ocanti leverages the existing workforce and supports them to grow and scale because they know their communities best. Ocanti's position to make culturally congruent and highly personalized care in our communities the standard of care. 12% of birthing people currently use doulas by paying out of pocket. And in our first phase of growth as a marketplace, we captured this market as well as the emerging market for insurance billing and reimbursements from employer-sponsored plans. 43% of pregnant people are served by Medicaid. And our marketplace offering by phase 2 will have built our capacity to operate as a managed service provider with the ability to serve 100,000 members. Managed care providers, managed service providers, are paid by how much they can save the insurance company, and we'll be saving them $1.5 billion at this point, generating $34 million in annual revenue. Without a workforce, there's no opportunity, and Ocanti is the only solution building a worker-centered answer to this need. Here you see that modest growth in phase 1 positions us to serve more than 80 markets by 2027. Our revenue model in phase 1 is based on annual recurring revenue and fees for care booked and billed on the Care Finder. But having proven our capacity, we will work with managed care with B2B contracts starting at $2 million annually per market. We've been keeping a great pace over the last 12 weeks, adding a total of 66 subscribers in 5 states. Today in the US, there's a magic coming together of policy support, payer dollars, funding, and consumer demand. Help me and my team to connect parents to culturally appropriate care that saves lives while creating an empowered workforce. Ocanti is making quality care available for us all by innovating the ways that care workers serve their communities We hope you'll join us in scaling impact and as an investor.